I'm so aware of my leaning forward, leaning back. I don't want to.
I haven't seen you look like this since that VAD presentation.
That was a good presentation.
You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. Dudum, and this is Back at It with Dr. Decompression.
Welcome back. This is Dr. Dudum, the Back at It podcast with Dr. Decompression. Really excited today. We have our very first guest. Super stoked. We have Dr. Kamran Jahangiri, chiropractor specialist in San Diego. Name of his practice is San Diego Chiropractic Neurology. Amazing doctor, very good friend. We'll share some stories today. Dr. Cam, say hello to the audience for me.
Hey, nice to meet you all.
We're excited to have you here. Why don't we just start with telling us a few minutes of just what you're doing in San Diego with chiropractic, with neurology, your background, and give us some examples of the patients that you're helping and the amazing stories that you're doing.
Yeah, sure. So I've got a clinic. We're located in Sereno Valley, which is near Qualcomm, San Diego. We specialize in spinal and brain trauma. When I talk about spinal trauma, I'm specifically referring to things like disc injuries, stenosis, sciatica, that kind of stuff. And then brain injuries are more related to like concussion and more in the mild range or grade of like severity. And then our clinic is really catered towards those neurological issues. So we specialize in neuro rehab, and we also specialize in what's called spinal decompression. We utilize a lot of advanced technology, things like, man, this is weird.
This is fun.
All right, so I'm gonna start back over.
Oh,
Our
this is
clinic
great.
specializes in that spinal trauma and brain trauma. We utilize a lot of different technology, things like laser therapy, spinal decompression, vision therapy, vestibular therapy. It's a very comprehensive setup. We actually have two other doctors in the clinic, and we're what else am I talking about?
So tell us, that's awesome. Tell us for our listeners, because some people know about decompression, they know about laser, the vestibular therapy. For anyone that doesn't know, how does it work and how's it helping these people?
So spinal decompression is really an amazing piece of technology. It's like one of the pillars for us that we're utilizing with these disc injury and stenotic cases. A lot of these cases where people come in and they're getting nerve-like sensations down the back of their legs or into their hands and arms. They express that they're having issues with like bending forward and over time. And maybe they've even gotten MRIs showing that they actually have these types of dysfunctions where their discs are slipping. Gosh, I'm really
No, this is great. So you're doing the decompression. Talk to us about laser because we've heard of there's hot lasers, there's cold lasers, lights, different red, blue, yellow. What kind of lights? Tell us why yours are so awesome.
well. Actually, why don't we go back to the decompression? Why don't we get it right? Is that cool?
Love to hear more about the decompression.
All right. So decompression is really amazing. It's the technology is catered towards these types of disc injuries, stenosis, and other types of spinal related traumas. We love it because it's a very specific device that allows us to get in there in a non-surgical way and then decompress the areas where these discs have flattened out and are impinging on some of the nerves. And then they give you symptoms like numbness, tingling, burning. Maybe you're getting soothing sensations down the back of your legs. Maybe it's going into your arms, hands. So it's, from our stance, one of the most effective treatments, if not the most effective non-surgical, non-invasive way to approach these injuries. So, and it's been benefiting hundreds of our patients at this point. We've been doing this for a few years now, and we are in love with the types of responses we're getting from our patients with it.
How did you? That's awesome. How did you start doing spinal decompression? What made you guys want to start doing that in the clinic?
Well, what really catalyzed this whole thing was my own personal experience. So I actually have two disc bulges in my lower lumbar spine. So at the L3, L4 and L4, L5 joint spaces. And one of them was as big as 6 millimeters. So it was really pushing in. And I don't really have a bone to show you, but there's the spot where the nerve sprouts out. That's where the disc was pushing into. And this was actually something that I developed likely from working out the wrong way with poor form when I was younger. And then I really pushed it over the edge a little later, like in 2020, when I was doing some agility work. I stepped in the wrong, like a soft patch of grass, and I felt the disc slip. I felt something happen. I was like, ooh, that's not good. I stopped. And sure enough, the next day I was seized up all throughout my low back in excruciating pain, couldn't get out of bed. Uh, Ended up having to wait it out for about 2 weeks until I could really start working again on patients. So it really hit the pause button, just kind of like paralyzed me for a bit. And it was really rough. So I ended up seeking out different treatment options and was trying to figure out a way, how am I going to work on this? Because it completely changed how, like, what activities I could do, how I was going to approach work. Am I going to be able to work anymore? So I ended up asking around some colleagues, some other authorities in the field, and that's what led me to spinal decompression. And I actually got my first treatment, I think it was mid 2020. And within the first treatment, I noticed right off the bat, like, I got off the table and all of a sudden I could start feeling more sensation in my left legs. That's really where I was getting majority of the symptoms. It was going into my hip, my leg, and my low back. And I just got this instant relief. And all of a sudden I can start engaging muscles that I had no idea were actually shut off, that I wasn't controlling effectively. So it was really this profound moment. And I realized that this was going to be a pivotal part of my practice. It was going to be a permanent fixture there.
Wow.
And I had to share it with other people, basically.
So literally after one treatment, you started to feel a difference in that relief in the leg into the back.
Yeah, fortunately, in my case, that's how it worked. That's not really how it works with everybody, as you've experienced. Some people take a lot longer. Research shows it's really supposed to be around that 12 visit range. But for me, fortunately, home run right off the bat. I knew this was it. And that's really what sent me in that healing and recovery direction, finally gaining traction on this issue that I've been probably suffering from for a decade or more. But yeah.
Use that experience now to help patients in your practice.
Yeah, it's been a pivotal piece, and I think it's really helped shape the way I treat and allowed me to, again, uh, touch that many more lives in terms of, like, helping them get over the hump and get them back to being able to golf again or play with their kids, or, whatever activities that they've been missing out on.
Wow. And do you tend to gravitate towards those patients now based on your own personal experiences?
Yeah, I really love working with them. It's there's something to be said about, you experiencing that whole situation, that stressful trauma, and then getting over the hump and wanting and being very passionate about wanting to help others with that same issue. So yeah, it's been a really it caused my practice to take a big pivot towards, making that a large segment of it.
What a blessing. So then you use that, you helped yourself, you're helping patients now, and you're using spinal decompression as a primary. And then you mentioned a few other things like laser, the vestibular therapy, and then the brain injuries too.
Yeah, so we like you're mentioning, we have other treatment options that we or modalities that we couple with the spinal decompression, so things like laser, electrical stim. And then we also do treat other conditions like concussion and dizziness, migraine, other things that are kind of more neurologically related but higher up. But that used to be the main focus of our practice. But yeah, once this whole situation happened, again, we kind of shifted the ratio. Now it's probably an even split between the two, where we're seeing so many cases with people that are having these disc complaints and sciatica and whatnot.
So it totally shifted for you.
Yeah, it was a big moment. 2020 was a big shift for, I
Wow.
think, a lot of people. But yeah.
You've helped yourself. So walk us through, give us and the audience here, maybe a story or patient testimonial, a challenging case that you broke through with spinal decompression for them as well and changed their life, and maybe what they were missing, and then what you helped them get back in their life, similar to you.
Yeah, so I can give you probably a couple different case studies. First one that's sticking out of my mind more recently. She's a younger lady. She's in her early 20s. She came in similar type of experience. She has two different levels where her disc bulges are. Hers are actually L4, L5, L5S1. Those are the two bottom ones. She came in and I don't know if most of the listeners are familiar with it. Most people have heard of scoliosis. Basically, it's a lateral deviation in the spine, a lateral curvature. We're not supposed to have those curves to the side. They're mainly supposed to be front and back. Those are much more normal, healthy curves. So her posture when she came in, she was completely contorted, crooked, and it looked just like visibly looking at her, it looked painful, you know? And the part of the reason why she was having these lateral curvatures or the scoliosis was because, or was a response to the disc issues. But she was also getting some symptoms going down the back of her legs, numbness. She wasn't able to, once we actually started moving through testing, she realized that she wasn't able to control some of the muscle strength in her legs quite as effectively, even side to side. They were a little asymmetrical. And this was impacting her ability to work. So she couldn't go, she had to work because she's young and she's in school, but she was doing this to kind of pay off things and like just make her day to day. And so she was forced to still keep working through this injury, which most people would have to, right? She wasn't really able to take time off. She didn't have that luxury. So she's working through this. She's going through excruciating pain as she's working through, or as she's working. By the end of her shifts, she is basically laid out, can't really do things the way she's not able to go socialize anymore. She's not able to work out like she typically does. And basically we got her on the decompression table. We set the table to those levels where those disc injuries are, those disc bulges. And we were able to get her results within about probably 2-3 weeks. It took a little bit of fine tuning, but once we figured things out, we were able to get her up and she was already starting to sit straighter, which was pretty cool to see. It's pretty profound, actually. I had never seen somebody, it was like watching one of those viral videos online where, you know, a chiropractor works on somebody, they come in fully hunched over and then they're walking out straight. Like she was right up and down, and pain was decreased dramatically. She was only really getting mild pain toward the end of the day. And now we're sitting at 2 months out. Now she's strength training again. She's actually getting another job because she's not struggling with the physical aspects anymore. So she was able to get additional work. And yeah, it's been a pretty cool experience to watch her shift over time. Another really cool one. So that was the younger version or patient. So maybe let's talk about one of my older ones, because this is like a completely different age demographic, which you might not think somebody that's further down the line would be able to heal up as effectively. But I've got somebody that she came in from Palm Desert. She's actually in her mid 70s, and she's very, for her age, or she likes to be, and she's a very colorful person. She's like got a big personality. She loves going out and dancing. She does it every week. She's always doing social activities. She's very active. And this injury that she had in her low back, she ended up getting imaged. She was having similar deal, numbness, tingling down the legs, sciatica. And they ended up finding in the MRIs that she's got stenosis, arthritis. So the spots where the nerves come out in her spine, they were actually getting smaller. So that's stenosis. And when that space is smaller, it can irritate the nerves and actually give you those symptoms. So that she was dealing with that. She was dealing with arthritis, which is basically like new bone growth, right? So our body produces new bone typically because things in those areas in the spine are actually getting less stable. So it tries to lay down new cement to try to stabilize that area. So she was developing this arthritis, and it was as a result of these old disc bulges that she had probably from decades ago. And now she's feeling the symptoms from it. It's a perfect example of like, you can have these disc injuries and you're not necessarily going to feel anything till way down the road. But at that point, some permanent things have shifted. We can't make new bone growth go away, but we can do our best to try to make her life more comfortable and make her more functional. And she was very avid in the fact that she did not want to have surgery. Never wanted to end up on a surgeon's bed. So she was willing to give our treatment and trust us with the opportunity to work on her and help her get back to being able to dance and do all those social activities she's used to. So we did just that. And within 4 to 6 weeks, I want to say it was, she was able to get back on the dance floor. She was moving again. In fact, she was probably doing more than she should have. She got a little overzealous. She got excited that she was no longer having pain and weakness into her legs. So she really, it was a pretty cool case to watch shift over time. And now she comes in on occasion just for maintenance because, again, she has had some permanent shifts. So no matter what, at that point, you need to, just like you would if you had cavities in your teeth, you want to maintain, continue to get your cleaning on occasion. That's what she would do. She'd come in, she'd get her spine decompressed, she gets her laser, her electrical stim, all these different things, and then goes back and she's good to go for another month or two.
Two really cool stories. Those are amazing. I want to touch on two things that you talked about for the audience, the listeners. It sounds like most of the patients that you're seeing are trying to avoid spinal surgery. Is that kind of what your niche is in San Diego, helping people avoid spinal surgery with spinal decompression?
It's kind of one of those incidental things. It wasn't something that I was expecting to be the case, but in most of these cases, just like for myself, I didn't want to end up having to do surgery. I knew that it was a potential for it, but I was going to do everything I could to prevent that from happening. And yeah, that's a similar theme with a lot of patients. Most people, they don't necessarily clearly know like we might, because we have a background in this stuff, the pros and cons to getting a surgery, or the risks associated with it. So, but most of them are apprehensive to ever have something like that done because they know it's a permanent thing that they're going to have done on their body. It's an invasive procedure that comes with risks and also permanent changes. So yeah, it is a pretty common theme now that we've kind of fallen into.
Wow, that's awesome. You mentioned yourself and the woman in Palm Springs that maintenance care, and I'm sure you're probably like we do at our office. We're giving them exercises and walk us through a game plan or a program. Once they're done, how are you stabilizing and supporting that? What kind of exercises they doing? What's the maintenance program to kind of help them live their life?
Yeah, so we'll once we graduate a patient out of decompression, or just like the active acute decompression treatment, then we move them into more of a stabilization type of care, and that involves still doing some level of traction or spinal decompression, but we then move them into things like you're talking about, exercises, different types of core stability work. We really love the power plate or vibration therapy. We think that that's one of the best and most effective ways to gain stability back in the spine. The spine's a really interesting structure. Like I said, it's very adaptive. So it's going to try to protect itself from further injury. And one of the ways it does that, like we talked about, is arthritis or building up new bone. But in addition to that, it can also tighten up or splint some of the larger muscles in our back, which is why we can feel so much tension and compression in our back. Okay. Those larger muscles pulling and tugging will create that type of compression on the spine, but also a lot of pulling types of pains. So that's as a result, partially because the smaller muscles that attach in the spine actually shut off.
They stop
So
working.
yeah, they stop working. They shut off. So this is actually really common. It's well established in the research actually. So most of us spend time sitting, and over time those little muscles will shut off, and actually we lose stability there. And that's part of the reason why so many of us develop these disc injuries. But so it's really important for these patients that we get those smaller paraspinal muscles, is what they're called, to start engaging again and start growing back, because they actually atrophy and shrink. So one of the best ways to do that is with vibration therapy or putting someone on a power plate and having them perform the exercises on that.
So that's how you'll get them to stabilize the results.
Yeah, exactly. So we get them to do that. Those muscles start to grow. It's going to build better protection for that area in the spine. Not to mention, those little muscles are actually what give us our postural curves. And we need those curves there because those are essential so that the discs don't actually end up sliding around or herniating. So it's when those curves get lost, or part of the reason why the discs end up slipping out is because those curves start to straighten over time because those muscles have gotten weaker.
Got it.
Again, leading to that kind of compression to pop the jelly out.
A few more questions for you. You have time?
Yeah, absolutely.
Um, you mentioned people that are debilitating pain. What are signs that someone should come see you? What are the things that, hey, if you've got A, B, and C, if these are the signs, you got to call us, we can help you? What would those 2 or 3 things be that come to your mind?
Well, first thing that comes to mind is how bad the pain is actually getting. So that being said, no pain is really a good thing. Those are always alarms going off in your body telling you something's wrong. So a lot of people think that, if I push through this or if I stretch, it's going to go away, but that doesn't necessarily mean that you're getting to the root issue, right? So some other kind of signs and symptoms you should be looking for or thinking about: am I getting numbness and tingling into my hands, feet, arms, any of that stuff? Okay. If you're describing things like, I feel like I have sciatica, that's really a hot word. It's basically well correlated that that's going to be likely tied to a disc injury,
Okay.
mainly because those nerves that come and develop or turn into that sciatic nerve come from your low back. Most people don't know that, right? Other signs and symptoms you might be feeling: you might feel less coordinated or weaker in a leg or a certain body part, right? In one of your extremities, your hands or feet. Okay. If your grip strength's going down, that's a good sign. If you feel like when you're doing certain movements with a workout, if things feel asymmetrical from side to side, you might actually have something going on further upstream. Okay. Other stuff you might get: shooting, burning, those types of sensations. Those are really tied to nerves.
So it sounds like a lot of nerve type referring pain, hands, legs, or just chronic, sharp, kind of debilitating back pain.
You got it. Yeah.
Awesome. I want to talk about the things that you had tried. You mentioned all the other modalities you tried before spinal decompression. I know it's a frustrating journey. Walk me through the different types of treatments you were doing.
Yeah. So I had really, like I said, it was me exploring a lot of different options, and I was willing to spend whatever I needed to. So this was like a pretty expensive investment, but it was worth it for me because I wanted to get back to being active again. Like, I didn't want to regret not doing everything I could from a conservative stance to get to the point where I could go do something as basic as like playing a basketball game, right? Without back pain. So, but especially just so I can get back to being able to work. Otherwise, I was going to have to look into a different career, right? But some of the stuff that I was looking into was things like regenerative injections, because I didn't want to do more like medication based stuff just because I know so much like how that stuff works already, like with regards to steroid injections or nerve blocks. Steroid injections, it's pretty well known that once you get a steroid injection, the tissue's never the same again. The prognosis for that tissue to heal up well or get back to normal again is like it's zero. There's no chance of it happening because you just put steroids in that space, and steroids break down tissue. So even though it's going to help bring down the inflammation or put out the fire in the area and makes you feel better, it's not going to fix anything long term or the root issue, and it's only going to make the tissues more brittle and set you up for further injury down the road. Does that make sense?
Yeah.
Same thing with nerve block. It's basically a band-aid, and I didn't want that. It's not going to be good for me if I'm walking around with a band-aid or thinking that I'm feeling okay and then doing movements that are just going to make it worse.
You go play basketball, you're going to hurt yourself.
Yeah, exactly. So again, I looked into regenerative injections, things like stem cells, exosomes, PRP. I tried them all, in fact. I'm not sure whether or not they helped or not, but I didn't want to take any chances. So I did them anyways. But again, for me, once I got on the table, got stretched, did the spinal decompression. It, it was instant that I knew that something had shifted. I felt it. In fact, while the table was doing it, I could feel the spot that had been just irritating my system that whole time. And I don't know about you, but for me, when I'm in chronic pain, I'm not a happy person to be around. So I've got a team of employees and other colleagues that I work with. They weren't they didn't want to be around me. And I didn't want to be around other people. Like I had basically introverted. I didn't want to do anything. I was just in chronic pain all the time. I was just in a pissy mood. It wasn't an ideal situation. But going back to like that journey of learning what was effective, first thing, that spinal decompression was the number one pillar. Then I learned more about other things that I needed to snap into the picture for me, from my stance, my perspective. I had desiccated discs in the where those injured sites were, and basically that's a way of saying you need those discs need to stay healthy through having proper nourishment. They needed to have proper nutrition and fuel going to them, and they had lost that. So the discs themselves were starting to die off. They had lost that nutrition, that nourishment, and you get all that stuff through blood flow. And one of the common things that happens with these discs is that they lose the blood flow, or the blood flow that goes to the disc can get sheared because it is actually being pushed through, or that those blood vessels are coming from the bones that sit on top of them. Does that make sense? Yeah. So I had to figure out effective ways to boost blood flow in the area too. So that's why I started doing red light therapy or laser therapy so frequently. I personally like my Erconia lasers just because I know what they're doing. But any type of laser therapy is probably effective. But that way I knew I was getting more blood flow to push to the area. Does that make sense?
How often were you doing the laser?
Honestly, I was doing everything daily,
3 times?
sometimes multiple times a day. Yeah, I was like really hammering at it because I was finding this stuff was dose dependent. The more I did it, the better I felt. So, and then when I would take time off, I knew that I noticed the difference. I was starting to revert. So I needed to stay consistent with it, just like any good training regimen, you know? You want to stay on top of it. You want to create changes. I needed to make sure I was practicing what I preached, basically. So the final piece for me, again, in that uh, beginning portion of when I was just struggling with these acute symptoms, some chronic, was the electrical stim. So the electrical stim was really helpful for me because, again, like this stuff involves nerve injuries, right? And nerves run on electricity. So if you can give them the proper current that they need, they actually feed off that stuff, and it helps engage new growth. It helps them become more robust, stronger. And in addition to that, an added benefit is that it actually helps relax the muscles, and it'll pull blood flow to those injured sites.
Are you putting that on the leg or just the back?
Depends. So sometimes I would have it on the leg and the back. Typically it was both,
Got it.
because we use a special type of electrical stim where it sends the current all the way through the length.
What's the stim you have?
We have an ARP wave. We love the ARP wave because it's what's called a direct current. So not all electrical stims are built equal. A lot of people are used to using TENS units, which TENS units are a really good option because they help block out pain signals, and they can also help push blood flow to the area and help with swelling and stuff. But we wanted to get something deeper penetrating because I knew my nerves were deeper in the spine that needed to be addressed. So, and I really wanted to make sure that, again, I set them up for success so that they could grow and get stronger. So I use the ARP wave, and that sends a current along the whole thing. And that really makes sure that, yeah, I'm hitting those nerves that are really struggling.
You're running on the low back, and you're running at how far down the leg? All the way to the feet? That's
For me, my symptoms went down into the calf. So I had attached a pad down in the calf and then up in the low back so that is hitting that whole length of the nerve.
got it. And that you do that in the office now with patients?
Yeah, it's pretty standard procedure for us. Like everything that I learned about my body that worked well, we ended up translating into what we were doing in office. We picked up all the therapies, we bought decompression tables. Like it was once I knew it was good for me, I made sure we had all those units.
And we're always talking about different stuff like exercises and strengthening tips and postural changes that you're kind of evolving with, right? That you continue to add.
Yeah, so that was kind of once I got out of the woods with this stuff and I was in a better place, I was able to well, I needed to figure out how to, I was trying to figure out ways to optimize. Like, how do I get even further? Can I get even better? And sure enough, the next phase for me was trying to strengthen again those small muscles, those paraspinal muscles in my low back, which really give you your postural curves and create stability with those discs. Because I wanted to make sure I bulletproof that area so that I wouldn't make it worse down the road. I wouldn't end up having new discs that were bulging, above it or, wherever. So strengthening was just a natural progression. Uh, like we had spoken a little bit about, the power plate it has been a really effective tool to get those small muscles to engage. And then I perform those same exercises that are like the McGill Big Three that help with engaging those low back muscles on that same modality. So I'm really just coupling the thing and augmenting the heck out of it so that I end up with a crazy workout within minutes. It's wild. Like, I'm breaking a sweat on that thing
On the power plate?
within like 3 minutes. Yeah, it's pretty insane. It shakes you up in the best way. I have no other way to put it. It's like jarring how good it is.
Which model do you have of the power plate?
I've got the My Pro 5. I really love that device. In fact, everybody in my clinic loves it, not just my patients. All my staff loves it. They love using it. It's such a great little tool just to get a quick workout in. Like, you can do the same type of workout that would take you 30 minutes in like 3.
I'm loving this conversation. Uh, Doc, give us, for the listeners that want to follow you, engage with you, how should they connect with you? How should they connect with you or your office?
We've got a few different options. So some of the best ways to get a hold of us or follow us is through Instagram. We have our own business page there, and we also have it on Facebook. We also have our own YouTube channel where we're handing out some of that information for free about, some of the exercises you can do, stretches you can perform, all that kind of stuff, and just general information so that you can learn more about these types of disc injuries and what's actually happening. So you can get for Instagram, I think it's at SD Chiro Neuro.
And we'll post it up on the video for those watchers too.
Okay, cool. So you can send links. Yeah. But yeah, we've got all those different options, good, effective ways to just follow us and also contact us if you have questions.
Fantastic. Thank you again for joining us. Thank you guys for listening. Please connect, follow Dr. Kamran Jahangiri, San Diego Chiropractic Neurology. First guest on the podcast. We're excited, and we're going to schedule a follow-up in a few months to have him back on. I want to thank you guys for listening. And this is Back at It with Dr. Decompression. Thanks.